The Weight Watchers programme seems to engage with patients at a level we haven't experienced before. And with the support of primary care, I think that medicalising their need to lose weight, I think is hugely important.
This programme represents a really exciting opportunity for Bromley to be essentially one of the first places in Europe to try and apply the outcomes that were found through the trials done in America. They got a 58% reduction in risk in patients at 3 years. If we can do that, we'll have a really big impact on our patients' health, but also on how we can use our resources in Bromley in the future.
When I was made aware of the project, I was very eager to be involved and to be the lead GP. Diabetes prevention is something that is very dear to me, and I feel that preventing this time bomb of a medical problem is paramount. And certainly during my time as a GP, there hasn't been anything as robust as this pilot to address that problem.
If we can reduce people's weight, then their likelihood of developing diabetes is going to dramatically decrease. It can be done through quite simple means. It's to a certain extent within people's power, with the right support, to be able to do something that's really going to have a beneficial impact on both their health, not just through preventing diabetes, but also reducing the risks of many other illnesses and disorders. To know that we've now got a chance in our hands to really make a difference, to prevent the onset of this condition, then that's, you know, exciting, but also it's rewarding, because it means that we really are going to do something that'll be truly preventative.
I have at least 7 or 8 patients who started the programme being pre-diabetic, and after 6 months they now have normal blood sugars. And in particular, I have a gentleman who has had an abnormal blood sugar bordering on diabetes for at least the past 12 years, ever since I've known him. He enrolled on the programme with a little bit of scepticism, I have to say. 6 months into the programme, he is now not pre-diabetic, and he has a normal blood sugar following around 12 pounds of weight loss. He is very pleased.
We've absolutely got to use prevention as the way forwards for getting the most out of our resources. So what this programme represents is, if you like, the answer in many ways to the problems and challenges facing us in the future.
It's working, and that's the main thing. The project is working, which is why we want to get everybody on board, and we want to send the message out that this is the way to go.
I've been thinking for some while. I knew I had to lose weight, and getting the referral to this just gave me that spur that I needed. I feel so much fitter and more energetic. I've got a real joy for living again now.
It's been brilliant, actually. I've not found it difficult. I've not found it a chore. It's just been good, and I've lost weight steadily each week.
It was the kick up the bum that I needed from the doctor. I was obese, then I became morbidly obese, and I thought to myself, yeah, well, that is, that was it.
GP surgery phoned me up and said, fancy Weight Watchers? I went, 4, not off.
I can't praise it enough, to be honest, and I just hope other people get the chance to do it. It's, my GP said there's 18,000 pre-diabetic people in the borough of Bromley alone, and this pilot's for 120 of us, so we feel very fortunate. And if you think about the small cost of that compared to the vast cost of being diabetic to the NHS, it just seems a no-brainer to me.
Actually, I feel alive again. Yeah.